morning. My name is Lynn Pannen, and I'm a registered nurse and a care manager who loves old people. I'm going to tell you a story about Alzheimer's disease in Pierce County. My goal is simply to ignite feelings in each of you to become more curious about this disease. My passion for old people started at age 12 when I would visit nursing homes. This is Dolly. Here she comes. This is Dolly, a feisty woman who is my best friend and mother. She is the one who took me to visit older adults. I remember wanting to cheer up the residents, and thus my passion for geriatrics began. Of all the chronic conditions in Pierce County, Alzheimer's disease and the related dementias present multiple challenges in the community. It affects healthcare, housing, financial institutions, legal system, and the police. But more than that, it affects families, and it may be affecting you. With the aging of our community, and in particular, baby boomers, we know there will be more Alzheimer's disease. By 2050, it is projected that 14 million Americans will be living with Alzheimer's, which is up from 5.8 million right now. Early detection of this disease is critical. Once a diagnosis is established, it is important for a plan to be put in place. A geriatric care manager can help the family with the plan, customizing options that fit each situation. Alzheimer's disease challenges the best of families. We are fortunate to have many wonderful resources to draw upon in Pierce County, but we'll need more by 2030. The ADRC handles publicly funded elder programs led by our esteemed Bob Riley, wherever he went. And the Alzheimer's disease has much to offer. Another growing resource is private geriatric care management, which helps guide families through the dementia journey by providing consultation, advocacy, coaching, and the coordination of services. These professionals are invaluable to families struggling with this disease. Alzheimer's is one of the most costly and insidious diseases. The financial implications can ruin those who have not saved for their long-term care, and it certainly robs families of leaving money to loved ones. So let's look at some of the costs. For home care in Pierce County, on average, it's $30 to $34 an hour for a well-trained nurse's aide from an agency that is licensed and bonded. Remember, Medicare does not pay for home care. In Pierce County, we have lots of lovely assisted living communities that charge a monthly fee, and depending on your care needs, may cost $55,000 to $80,000 a year. The last stage of dementia may demand the use of a memory care unit or an adult family home, which can average $78,000 to $109,000. Dementia causes lost wages and stress in the workplace. Many of you in the audience may be involved in caregiving and also working full-time or having to take early retirement. Corporations are losing valuable employees to Alzheimer's disease. This woman owned a company and had to lose a big contract because of her father's dementia and her commitment to care for him. Some solutions companies are looking at are paid family leave and care management to provide the employee with education and resources. With the increase in dementia, we as care managers are also seeing more financial exploitation and credit card theft, just to name a few. Unfortunately, many family members are exploiting their parents or relatives. Last year, we had a client that stole $200,000 from his mother, and she had to go on Medicaid. Care managers offer ways to improve quality of life. These women were so excited to have their nails polished. And while this seems like a simple example, it may be the one thing that made these women feel beautiful on that day. In 2014, the Washington State began developing a dementia plan from the expertise of 35 professionals, all in the field of aging. It is now called the Dementia Action Collaborative, and we are asking DSHS to fund the plan and bring more awareness to the public. One great outcome is the Dementia Roadmap. Right now, all the home care agencies, nursing homes, hospitals, and assisted living communities are seeking to hire the same pool of worker, the nurse's aide. Going forward, I see this as a huge issue with more people to serve and less staff to serve them. As a community, we must find creative solutions. So what's going to happen in 2030? More suffering families and victims, higher costs, and more abuse. As an optimist, though, I'm hoping for early medical detection, some research breakthroughs, more caregivers, and a better understanding of how to treat the behaviors of Alzheimer's. This is a complicated disease. My wish list for the future is long, but I'll only give you my top 4. Each family would have a professional dementia specialist or care manager who would provide support and direction. Colleges would provide courses on how to be a family caregiver. We would reduce healthcare costs, especially drugs, and expand the use of technology to make our human involvement more efficient. Thinking futuristically, use hospitals for only acute care and not dementia clients. Through legislative change, offer more end-of-life options, improve laws to punish those who financially abuse seniors, and provide geriatric teams of care managers and MDs to coordinate care. So what are we all going to do? Educate yourself on all the dementia types, live a healthy lifestyle, seek help early, learn behavioral interventions, and seek local support. Be a family. Be kind and empathetic to those who are Alzheimer's victims. Be involved and help me fight this disease.